Hi, I'm Jeff McDaniel. This is Bulletproof Bootcamp day number 9. If you're just jumping in, this is a 21-day at-home series you can do to really kind of prevent injury, get rid of chronic joint pain, and really kind of improve your fitness and overall performance in life, movement, function, you name it. So today we're going to go after the glute hip rotators. I've got a foam roller and a softball, and let me just say real quick that kind of what we're doing is working on the concept of proximal to distal, meaning, you know, if you got pain in ankles, knees, elbows, wrists, things like that, we really want to start more closer inward, hips and shoulders, and then work outward. Start proximal and work distally. So even if you have, for instance, like your knees are achy, start with the hip because it's the hip that controls the femur, the bone that leads to the knee. And if we've got issues with the hip, we're going to have problems with our knees, ankles, feet, all the way down. So we're kind of starting more inside, working out. So today, the glute hip rotators, you got two options. You can use a foam roller, grid roller to kind of get into some of those areas. If you want to get more specific, a softball will do the trick. So again, this is going to get a larger area. This is going to get more specific, targeted areas. So I'll let you kind of choose which one, mix them up. They both have their option. We're going to start by getting on that left hip, and here's some options for you. The glute, we're talking about a large area, a large muscle. You've got the mid glute, the upper glute, you've got over here around your hips. So I want you to get in, and we're gonna spend 2 full minutes on this side. You can go longer, and I'd probably recommend it, especially if you got some tightness. But your options, 2 minutes on this side, is legs straight or knees bent, which is gonna get a little deeper. You can also go over into this kind of pigeon position and work different areas. I really want you to get into the areas of high tension, areas of pain. If it's painful, that's a sign that we've got scar tissue, adhesions, some things that we want to try to get in there and kind of gently massage out, improve circulation, blood flow. Now you can also add some motion like this clamshell. So I'm showing it with the foam roller. Now you can, and based upon how much pain there is, because we want to go deep enough that you feel like you're making a difference, but not so much that it's unbearable. But if that's okay, progress into like a softball. So again, this is going to be a little deeper. And again, if you got some trigger points, some areas you got to really kind of focus on, the foam roller is going to get more globally, surface area. This is going to get into those areas. Again, it can be over towards your hip or that. Now, what I like to do is, we talked in week 1 about the pigeon stretch. So once you have done 2 minutes of some self-massage on each side, get into that pigeon stretch and really try to lengthen out all the areas that you were just massaging. So 2 minutes of massage on each side plus 2 additional minutes of stretching in the pigeon. That's an 8-minute homework assignment. Hips will feel amazing. Give it a shot.